let's cap the series of Fundamental of Nursing with medication administration. 12 good questions based on content. It's all content. So I'm going to use it to lecture you and show you things you need to know in terms of medication administration. Stick around and let's go. First question is a dose calculation by its medication administration, right? What is the ml per hour rate the pump should be set to administer the drug? And then receive an order to administer what? 40 milligram intravenously in 50 ml of 5% dextrose in water over 30 minutes. Sometimes when they say these kind of questions, they're very, very confusing. Just relaxed, okay? And then receive an order to administer Linezolid 40 milligram intravenously in 500 of D5 in water over 30 minutes. Just write it down. What was prescribed? They give you a bunch of information, but you're not going to use it. That's the problem. That's what confuses people. They want to use all the information. You don't need to. They said, what is the ml? So what I need is an ml per hour. That's all. And I was giving 40 milligram IV in what? 500 ml in D5 in water over what? 30 minutes. Or I was prescribed. You don't even need to use the mass of it. It's just the volume. The 50 ml is being given over 30 minutes. That's all. But they want you to give you the answer in what? ml per hour. Well, I just converted 60 ml minutes per hour. It's the same. 60 minutes is the same as 1 hour. If I write this 1 hour, they will cancel it. But I changed an hour into 60 minutes. So this cancel this. You have what? 50 ml times 60 over 30 hour. This go here like 2. So the answer is what? 100 ml per hour. Because we cannot set the machine 30 minutes, so we will set it 100 ml per hour. But because we only have 500, when the fluid finished, the system will shut off. So this is wrong, this is wrong, this is wrong. So this is what you set in the pump, 100 ml per hour, even though you have 50 ml. Okay? So that's the right answer. Number 1 is done. Medication administration. Number 2, key terms about medication administration. What type of medication effect client develop? A nurse is caring for a client who is taking the digoxin for CHF. Patient develop unintended secondary effect. It's a secondary effect of the drug. That was what? Predictable. There's a bunch of buzzwords that I underline. Unintended secondary effect of the drug that was predictable. What do you think it is? Therapeutic effect is what you desire. So it's off. What is an adverse effect? It's very severe form of side effect. And usually when we see this, we stop the medication right away, that we will need some reversal agent to take care of it. Toxic effect, that is very harmful. This is very harmful of the drug. And it may indicate some overdose. Like you have the digoxin 2.5, yeah, that's the toxic effect of the drug. And you're seeing yellow changes in your vision, yeah, that's toxic effect. The side effect, okay, the side effect is what is unintended secondary effect that is predictable. It can be harmful or not harmful. So side effect is always, we know, that's what we tell you. When you go and buy a medication, they write a bunch of side effects on the medication. It's unintended, but we know that is going to happen. You take antibiotic, you have diarrhea. It's unintended secondary effect, but it's predictable that you're going to have diarrhea. So that's the side effect. It's good to know definitions. Number 3. Which of the following administration technique shows correct understanding of the order? A nurse receive an order for a tablet to be given via what? The Buccal route. What is that? is between your cheek. Basically, you put a medication between your cheek and your tongue, your teeth will protect it and it get absorbed. It's different from sublingual. Medication was placed under the tongue, under tongue. Tongue is lingual, under is sublingual. Medication was placed over the tongue. That's the usual way we put medication. Medication was held between the cheek and the teeth. That's buccal, that's your cheek. Medication was placed at the back of your throat. Yeah, it's the same normal way we take it. So 2 and 4 are saying the same thing. 3 is the right answer. Number 4. Select or apply. Which of the following routes, okay, the nurse should include? A nurse is teaching new graduate about what? Parenteral route of medication administration. You see what I'm doing? I'm just dividing the thing. There's 2 words there. There's, when you say enteral, that is mean oral. Pa is outside the oral. Therefore, which of those is outside the oral cavity? Subcutaneous is outside. Intradermal is outside. Oral is oral. IV is outside. And IM is outside. So that's which of the following routes you should include. Those are per entry outside. Number 5. What do we have? Nurse enters a client's room to administer digoxin for CHF. The client refuses the medication. What is the nurse's best action? There's always temptation. Patient refuse, you go and document. No, you have to. Don't leave the room and document the finding. Don't call the physician. You got to do your job as a nurse. Assess the reason. Find out. Always find out why the patient does not want to take the medication. And if he says something wrong, correct the misinformation. And after you've done that, then you can leave and document. If you refuse still, then you let the doctor know. So first you assess the reason for refusal, correct any misinformation. If he's still refusing, leave the room, document it, call the physician. Tell the client the consequences of the refusal is part of when you try to find out what is the problem, correcting information. So this is wrong. So 3 is the best answer. Number 6. Which of the following rights of medication administration the nurse is demonstrated? The nurse demonstrated. A nurse enters a 75-year-old male client's room to administer digoxin for CHF. The client apical pulse rate was what? 59. The nurse held the medication. Which of the following rights do you think the nurse is showing? Think about it. All these questions, stop the video, do it yourself, and then listen to the way I will approach it and see if you can master some of the test-taking strategy. I've underlined the keyword. Patient has apical pulse. The nurse held the medication because she thinks it's not appropriate to give it to the medication to the client whose digoxin, whose apical pulse is less than 60 when while taking digoxin. Therefore, what do you think? She made the right assessment. It's not the dose that was the problem. Evaluation is after you give them the medication and find the side effects, the outcome. She made a right assessment and realized she does not need to give it to the patient. The time is when you check the time and compare it to the MR. So this is a right assessment, not evaluation, no time, no dose. Number 7, medication administration. Which of the following actions are appropriate? A nurse is caring for a client who is receiving what? Enteral, oral feeds through NG tube. Client is due for acetaminophen dose, which comes in tablet. Rewrite the question. All I'm asking you is, which of the following actions are appropriate when the patient is getting tube feed and you want to give them some medication through the tube feed, NG tube, that comes in tablet. Which one actions appropriate? Of course, put them up semi-fowler to prevent aspiration. Check the NG tube replacement to make sure it's in the right place. Flush the tube with 15 ml of sterile saline. 15 is too small, it's 30. So 30 cc, you use 30 cc to basically flush it, so 30 cc. Crush the tablet because it's a tablet. You can put it to the tube and mix it with warm water. Administer the medication. Then after that, you flush the tube with 30 again. So which of the following action are appropriate? 1, 2 is fine. 4, 5 is fine. 6 is wrong. 3 and 6, you need to increase but the order was all right. You just need to increase the amount of fluid to wash the NG tube. Number 8. After teaching a new graduate about Z-tract technique, which of the following order steps need further teaching? This is the order step. Z-tract technique is an IM technique of injection. And this is because we want to prevent the medication from going into the subcutaneous area that will irritate it. So when you're injecting, you do certain steps to keep the medication in the intramuscular space, right? First, you pull the skin 2.5 centimeters at least away laterally. So this is correct. Inject the medication. You inject it. That's correct. You don't release the skin. You remove the needle first before you what? Release the skin so that you can the point of injection will be completely gone. Therefore, 3 and 4 are flip up. So these other steps need further intervention. Remove the needle, then release the skin. That's what you do with Z-tract. Like I say, it's all content I'm giving you here. After teaching a new graduate about colloids, which of the following indicate further teaching? That's all. Which of these indicate further teaching? Or I'm asking you, which one is not colloid? Which of the following indicate further teaching? Albumin is a colloid. Dextran is a colloid. Starch is a colloid. This one is not a colloid. So don't list that as a colloid. 3% is a crystalloid. The rest are colloid. And number 10. A nurse is caring for a client whose IV line area is what? Swollen, it's cold, it's pale, and causing discomfort. You see, bunch of bars where. Which of the following complication the nurse should document? IV line, cold, swollen, pale, causing discomfort. What do you think? Extravasation, if I'm going to say extravasation, I will use the word vesicant. But this is bad. This one, you go into the tissue, deep tissue, and causes necrosis. This description, it does not consistent with extravasation. Pheblitis, I will talk about the vein. You see, that is the way you answer question. You expect the description of a vein where it's palpable. I never said that. Infiltration is perfect. Fluid go there, you don't get cold, swollen, and it's painful. Infection, things, I'll show you signs of infection. Erythema and all those things. Never said that. So this is infiltration. It's IV therapy. Number 11. The client became what? Acutely dyspneic, hypotensive, bradycardic when the caring nurse was changing the IV tubing system. What is the nurse best action? The nurse is changing the IV tubing. All of a sudden, patient short breath, hypotensive, bradycardic. What do you think? When you pull in the line, air basically gets sucked in and you have air-embolism. The first thing you should do, prevent ongoing air-embolism. Giving them oxygen does not fix it. This is appropriate. Position them in the left triangular bag, but there's still, if you leave the source, there's still air coming in. Clamp the catheter is best. Calling the doctor, the patient will be dead. So clamp the catheter, place the left triangular bag, and then give them oxygen. Then you call the doctor and pray for better outcome. So 3 is the right answer. Number 12. What do you have? And this is teaching you graduate about non-crashing medications. Which of the following listed by the new graduate indicate need for further teaching? That means you're teaching the client about the new graduate about medication you should not crash. So which one of this, if listed by them, indicate they don't understand what it is, right? Bacterium double strength is crashable. So this is no. Amlodipine extended release medication are not crushable. Okay. So which of the following listed by the could indicate need for further teaching? So a nurse is teaching new graduate about non-crashing medication. If they list this one of them, it means they don't know that you cannot. So this should be crash, should not be crash, right? Bacterium single strand can be crash, right? So that's eliminated. Amlodipine sustained released should not be crash, right? Aspirin time release should not be crash. Amlodipine sustained release, extended release, and aspirin time release. So those are correct. Those that the new graduate added that can be crash are 1 and 3. So when these are listed, those are wrong. So this need further teaching, need also further teaching. 1 and 3 can be crashed. So she's no need to list them. All you're supposed to list is the non-crashing. So 2 is non-crashing, 4 is non-crashing, 5 is non-crashing. 1 and 3 can be crashed. So list non-crashing, not the crashing ones. So this is the end, 12 questions. I hope you gain something out of it. Thank you for watching. All the best of luck. Thank you.